Good morning, everyone, and welcome to day 2 of the 2021 Howard L. Bost Memorial Health Policy Forum. We're delighted to begin this morning with Eva Stone. She was selected as the 2019 Kentucky Nurse Association Nurse of the Year and named a 2020 Louisville Business First Healthcare Hero. Eva Stone is the manager of District Health for Jefferson County Public Schools and also an adjunct professor at the University of Kentucky College of Nursing. She's worked in public school health for 20 years, and she is here today to talk to us about vaccines in the school system. Very interested in what you have to say, Eva. Please go ahead.
Thanks, Bonnie. So good morning, everybody, and thank you for this opportunity. I am going to just spend the first few minutes talking about vaccines in the school system. I'll talk specifically about Jefferson County schools, but a lot of this conversation relates to school districts in Kentucky, and what an important and timely topic for us to be having, because if anything else, the COVID pandemic has certainly highlighted the disparities that exist and the gaps in care for so many of our families and children. And so this is an important discussion to be happening. So thanks to the foundation for this forum and for addressing these topics. So school districts in Kentucky, we have a regulation that requires students to have their immunizations. They're supposed to present a valid immunization certificate within the first 2 weeks of starting school. Early childhood preschoolers really are supposed to start school or not start school until they have that certificate in hand. And then some districts might have enacted policies that require children to have that certificate in hand when they start school. But legislatively, they're supposed to present a valid certificate within 2 weeks of school. In my experience in the districts where I've worked historically and in more rural areas and then here in JCPS, these mandates, while they're well-intentioned, aren't always the most effective strategy to help improve and increase our immunization rates. And to give a context for that, here in Jefferson County, where we have nearly 100,000 students, we've got about 6,000 students who are homeless. And that was prior to the pandemic. We've got about 12,000 students who are enrolled in our English as a Second Language program, which they are immigrants and refugees, and they've experienced access issues. And so there's some significant disparities in some of the requirements to have children present these certificates when they get to school. So it's important that we look at the systems and the systems that are in place within communities that can really support making sure that people have access to these vaccinations. So a little bit of history of this. I started in Jefferson County in January of 2018, and at the time, the hepatitis A vaccination had become a requirement in Kentucky. If you remember back to that time, we had an outbreak of hepatitis A, and just think, we thought that was a big ordeal, which it was. You compare that to the pandemic now, it kind of pales in comparison, but there was a outbreak of hepatitis A across not only Jefferson County, but in the state. And so Kentucky enacted a requirement for students to have 2 doses of the hepatitis A vaccine. And so when I started here, we started looking at those grades and looking across those grades. And typically, we report to the state on grades, kindergarten and 6th grade at the time. Those are what we reported to the state each year. And when I really began looking at those grades, there were some significant concerns when seeing those immunization rates for children. And we've got about 155 brick and mortar sites in Jefferson County, so you can imagine that that's a pretty monumental task. But when we did a deep dive into that data to really look at it, it showed that nearly 1 in 5 of our students, over 19,000 kids, were not compliant on their immunization, on their immunizations. Nearly 1 in 5 kids did not have current immunization certificates. And so I really wanted to look at that information and that data because I wanted to see where the disparities were. And they're pretty glaring. Almost 92% of those children were kids who were living in poverty. and 61.4% were children of color. And so there's some significant health disparities related to immunizations. I'm sure not just here in Jefferson County. I'm sure this is an issue of poverty across the state. That is one thing I would challenge us to start looking at our immunization and our immunization data. This is very significant because this is telling us about how children are accessing the healthcare system. And if you look at, you can also look at physical data across the state. School districts have to report on children in kindergarten and 6th grade, whether they've had a preventive health exam that they're supposed to have. Our 5 to 6 year olds are supposed to have a dental screening. And if you look at that data, there are disparities among our children. And so as a state, I would challenge us to begin to look at that data more specifically related to the disparities that potentially exist. One of the issues is that our kids could only see the provider that they were assigned to with a predominant insurer in the area, and that presented challenges for some of our families to be able to access those providers. And we also we had a pretty low participation rate in the Vaccines for Children program among the providers. And I want to say one of the things that we did several things to really look at this information. Our Department of Health here in Jefferson County is pretty phenomenal, and we started meeting early on to address this problem. The other thing we put into place in Jefferson County was a health advisory council. And I'm going to say several of the people that you have on the agenda to speak today have been involved in this work. And so, again, we didn't have a lot of providers that were participating in the Vaccines for Children program. So what was happening is kids were assigned a medical home, and they might go to that provider for a preventive health exam. But if that provider wasn't enrolled in the VFC program, then they would recommend that they go elsewhere to have their vaccinations completed. Typically, that was the health department. And our public health system prior to the pandemic across the whole state and outside of the state of Kentucky has not been a well-funded institution. And at one time in Jefferson County, they were down to one nurse to be able to give immunizations through no fault of their own. And so that makes it a big challenge for families to get, particularly if you're a family that works a job or 2 jobs that aren't very forgiving about missing work. And so again, we need to look at the disparities and where the disparities exist. That's what we've been striving to do here in Jefferson County. Another issue in Jefferson County, but across the whole state, is in Kentucky, we're pretty fortunate. We have a statewide data system, which is Infinite Campus, and that's across all the school districts in the state. A lot of states don't have that, but we have this system, and historically, public health has worked really hard to try and make that system interface with the immunization registry. And have not been able to successfully do that in the past. And so when those systems don't communicate, when I shared that data about 1 in 5 children not being current with their immunizations, to take 20,000 kids and manually have to look every one of them up in the state immunization registry is not a very feasible task. And so in our health, in our era with technology, that is a pretty challenging problem that should easily be overcome. And then I apologize, I've cut off part of this slide, but again, some rules for limiting families to who they could see to have immunizations done presented a particular challenge for many of our families here in JCPS. So lots of work has been underway to work with the local health department. The Board of Health actually even created an immunization committee that they meet regularly to discuss this. Our Health Service Advisory Council meets quarterly. Dr. Richardson is speaking today, and she will quickly tell me and has shared with our group, this immunization problem, this gap in care is not just a JCPS problem. This is a community problem, and we have to look at this problem as an entire community. And I would say that every community in Kentucky that shows these kinds of disparities, it is a community issue that we need to figure out how to address. In Kentucky, In December of 2014, the federal Medicaid program, which allows schools to bill Medicaid, up until that time had limited that billing to students who had an IEP. Well, in December of 2014, federal Medicaid, CMS came out and said we were wrong to limit that billing to just those kids with an IEP, and that was called reversal of the free care rule. And so that allowed for expanded billing for schools in Kentucky. And so Kentucky submitted a state plan amendment in the spring of 2019, which would allow us to access that expanded billing. And that was approved in November of 2019. So school districts across the state that participate in this program can actually bill for additional services, whether that's mental health services. In my world, that's nursing services, which can help us address this problem. So in Jefferson County, what we've done is we've become providers for the VFC program, and so that we can use school nurses to help administer vaccinations. Again, we're talking about nearly 20,000 students potentially, and so that's just one piece of a very large system problem that we need to address. Because of the pandemic, we've been able to bring on additional school nurses in JCPS, and so we've actually brought on about 100 additional school nurses. We've put a nurse in every school. Right now, they're pretty overwhelmed and consumed with contact tracing, but our plan is to have this foundation so we can address this on a more personal level with the schools. And then most significantly, and Mr. Bledsoe is on this meeting today as well, last Tuesday, our Board of Education approved a data sharing agreement with the Kentucky Health Information Exchange. And so one of the things we did related to the pandemic was to implement an electronic health record. And so Frontline Health is what that is called, and the health record will interface with the registry so that we can start accessing immunization information. That's significant for us because it involves students as well as staff. Infinite Campus can also, other school systems that maybe don't have that EHR could do the same with have the same opportunity to interface with Infinite Campus, as I understand, but that does not house employee information. And so the electronic health record, again, is a very significant tool for us in Kentucky, not only for COVID management, or in JCPS for COVID management, but also for addressing immunizations. And so finally, just some other things to consider. We are working on memorandums of agreement with area pharmacies so that we can expand access. The goal is to make sure that every school in the district is connected with somebody who can help address immunization needs and gaps. School-based health centers. Ms. Hagan is speaking today, and she's one of our great partners who we're working to expand the school-based health centers that we have in schools to address these kinds of issues. We want to bring care to where the students are, and this is a significant issue because, again, if they're not getting their immunizations, they're likely not accessing the health system. And to give you some context, we know that we expect students to not have gotten those preventive services over the last year, and here in JCPS, our data from the end of the school year showed that only 60% of our kindergartners had a preventive health exam, and 9.9% of sixth graders. So we have some significant issues when it comes to access for care. And we've also expanded our MOAs with one of our local healthcare systems. Norton Healthcare will be helping us with immunizations. And then again, our school nurses have become VFC providers. And so I just want to share, last thing is that for each of you who may reside in Kentucky, there is the State Department of Education has on their website open house. You click supplemental data, you can go to student health. You can actually look at student health data, and you can look at it by county. You can look at immunization data by school for those grades that we report on. And I think that is one of the significant tools that we have to begin to address these issues, to start looking at disparities, and really to recognize that when kids aren't having these services, it's not about non-compliance, it's about lack of access to the system, and what can we do to improve that access children have.
Eva, thank you so much for that wonderful presentation. Just fascinating. It really sort of boggles the mind what schools are up against right now, trying to deal with this pandemic. It really, you all are you've got a heck of an issue on your hands, many issues. It's just very interesting to hear about the disparities. That was I think a compelling presentation. And I'm not sure that everybody realizes just how deep those disparities are. I suppose it shouldn't be too terribly surprising, but it's deeply disturbing nonetheless.
Absolutely. Absolutely. Yeah. Appreciate your work.
Well, thank you so much.